Merhabalar, yanımda dünyaca tanınan önemli bir doktor var, jinekolog. İtalya'dan misafirimiz olarak geldi LA&HA Kongresi'ne hem de konuşmacı olarak. Sayın Doktor Marco Gambacciani, İtalyan Menopause Society Genel Sekreteri. Kendisiyle birkaç konu hakkında konuşmak istiyorum. Özellikle gynecological lazerin dünyadaki kullanımı, İtalya'daki kullanımı nasıl büyüyor? Ayrıca en çok sevdiği uygulamalar neler, hastaları memnuniyeti nasıl? Bunlarla ilgili konuşma yapacağım. Hello Marco, how are you?
Fine, thank you for having me today.
Thank you. This is your second time in Fotona LA&HA meetings. In 2003 was the first one. While I just quote you here, I want to ask a question: how the gynecological laser applications going in your country and in the other countries as well, globally? And your best applications, what would you suggest the gynecologist as your best applications and the customer feedbacks?
Oh, actually, I'm using laser since 2013, and this year, as I see, an expansion of laser application in gynecology. We first started using a laser for vaginal atrophy, for urinary incontinence, for vaginal prolapse. But as you know, there are very different applications also nowadays. We do have applications for lichen sclerosis. We do have application to treat the scars after the episiotomy and episiotomies that can be very painful. And so we do have a lot of different applications. And during this year, we learned a lot how to personalize the treatments. And we do personalize the treatment mainly in women that they do not respond, for example, to vaginal atrophy after menopause. Even if women are prescribed hormones, not always the effects of hormones are very effective on the vagina. And vaginal laser is of help in many cases.
The patients are knowledgeable. I mean, they know these applications, or how this
is becoming more and more popular. It's becoming more and more popular because women talk each other. And when I treat a woman, often I see her sister, her friends, her neighbors, their relatives, because the treatment is very effective. And the treatment is not painful, the treatment is not dangerous. We can have the best from very simple treatment in 15-20 minutes. And as I said, we can pair the laser treatment with other treatment, with local treatment that can be very effective, but not always. And women are not always very well satisfied, for example, from pelvic floor exercise for incontinence. Pelvic floor exercise can be annoying. Women don't want to do it. With the laser, we can reinforce the effects of pelvic floor exercise. We are complementary treatments for stress and incontinence are very effective. No pain, no downtime. Women can have their everyday life. They don't have to do any specific treatment before or after the laser treatment. So it's becoming more and more popular. The problem is that a lot of gynecologists, they don't know about it, or they pretend that the laser is the king. The laser is the only actor. Laser shouldn't be the only actor, but it's a very important tool for a gynecology everyday practice to improve the answer to the questions the women are raising. For the women health and the women quality of life. Nowadays, I should say that without my laser, I hardly can provide the same level of assistance as I provide now with my laser.
Yeah.
For pre-menopausal women suffering from stress urinary incontinence after parturition, for example, for postmenopausal women suffering from vaginal atrophy, dyspareunia, and again, stress urinary incontinence, that, as you know, can even can get worse after menopause. And some peculiar aspects of women's quality of life and disease, that is the lichen. The lichen is responding very, very well to the treatment with the Fotona lasers. That's very important because, once again, we don't want to say that with the laser we do everything, but we can help a lot of different aspects of women health and quality of life with the laser.
Can you say that in Italy it is widely used by doctors, or it's becoming popular among doctors to use lasers?
It's becoming popular. It's becoming popular, and I should say that 3 different public hospitals offer the laser treatment for free, mainly to breast cancer patients that they are delayed can be treated with hormones after iatrogenic menopause, or women treated with aromatase inhibitors that shut down any estrogenic action in the human body. In these cases, the laser is very, very important for women's quality of life, sexual life, and so on.
Do you think it is attributed to the type of lasers you're using, or can you say it for any other user?
Actually, the best lasers in the world are the non-ablative lasers that can induce a revascularization, collagen synthesis, without inducing any harm. And particularly the erbium laser with the patented Fotona Smooth protocol is the best because it induces, let's say, the tissue rejuvenation without any lesion, without ablation, without any lesion that can be, first of all, painful. And afterwards it takes a lot of time to be recovered from. So with the Fotona Smooth laser approach, you don't have downtime, you don't have pain, and the treatment can be easily repeated many, many times because we don't provoke any lesion.
Hopefully it matters when the patient gets older, I guess.
Sure, and also matters when we treat patients for example, for urinary incontinence, and we need to do maintenance treatment every year. So we are very confident that we are sure that we are not provoking any lesion, because the smooth technique is intrinsically per se safe because it doesn't do any damage to the tissue.
Because I think 2019 warning of FDA was talking about certain type of application, which was
they were referring to CO2 lasers that are microablative,
problematic.
And, by the way, also
they are also
with the CO2 lasers, they are not so dangerous like the FDA warnings were pretending to be. And without any solid evidence-based medicine on the background at all. But definitely, if you avoid even the micro aberration, is even better. And with a Fotona Smooth, we don't do any ablation at all.
I see. Can you tell us what kind of applications you like most, or your patient likes most? Maybe 1 or 2.
I mean, this is a very difficult question.
Maybe I should put it another way. Maybe the patients are calling your clinic for specific applications.
Yeah.
Do you have such a popularity in some area?
Yeah, I am in Italy. I am known as a menopause guy.
Menopause.
So I do see many women for menopausal complaints, and therefore I treat many women with a laser for vulvovaginal atrophy or genital syndrome of menopause, as you wish. But we have to say that a lot of women, they don't have just one indication. Because a lot of women, they have atrophy and urinary incontinence. Maybe urinary incontinence is not so severe to require surgery.
Yes.
But still is a present and still it reduce the quality of life. They have to have diapers every day. They have to wake up 2 or 3 times at night, so interrupting the sleep.
Yes.
And the sleep is the guardian of our health.
Yeah.
As if we want to, if we can reduce the nocturia, we do induce a very good effect on women's health because we preserve the sleep.
Yeah.
And so when you say which is my favorite application, I should say the most bothersome symptom for my patient. If it's atrophia, it's atrophia. If it's urinary incontinence, it's urinary incontinence. But often in the same patient, I have a different, a mixed indication for laser. And this is very rewarding as a physician to treat in 20-30 minutes time to target 2 or 3 different needs of our patients. As a physician, it's very rewarding.
Thank you very much.
Thank you.
Thank you very much. Thank you very much.